Good morning, fellow citizens of Massachusetts. I'm Sophie Briggs, and today I'm here to inform you on a very important topic, the tick outbreak this spring-summer season of 2018. Between years 2015 and 16, the amount of people infected from ticks and mosquitoes jumped 40,000 people, and the rates this year are said to have tripled. The types of ticks and the germs they carry are spreading rapidly to new areas where people may not be immune to the bacteria, which puts a ton of people at risk for infection this year. So if you're a frequent outdoorsman or a gardener, this announcement will be very important for you. It's very important that you're checking your local public health programs in person and online to be informed on more frequent information after you're done listening and watching this PSA. Information is circulating and changing every single day, so something you're informed of now might be different tomorrow. One thing that especially is important to look out for are the early onset symptoms of Lyme disease, the most common infection that comes from the infected ticks. Lyme disease is a bacteria transmitted by the deer tick. The symptoms of Lyme disease affect the skin, nervous system, heart, and joints. It can affect people of any age. Symptoms specifically include a bull's eye or solid patch about 2 inches in diameter that will expand and appear at the site of the tick bite. More common symptoms include chills and fever, headache, fatigue, stiff neck, muscle or joint pain, and swollen glands. Be sure you're paying close attention to picking off any ticks you see on your body before these symptoms can appear. This is because once you have Lyme disease, it can take anywhere up to 30 days for symptoms to appear, and by then it's too late to completely kill the bacteria in your system. Lyme is usually treated with an oral antibiotic, and if caught early enough, that will kill everything active in your body. If you do spend lots of time outside, your risk for being bitten by an infected tick goes up, but there are some ways to prevent this from happening. Wear light-colored clothing with a tight weave to spot ticks easily. Wear enclosed shoes, long pants, and long-sleeve shirt. Tuck your pant legs into your socks or boots and shirt into your pants. Check clothes and any exposed skin frequently for ticks while outdoors, and check again once indoors. Consider using insect repellent, stay on cleared, well-traveled trails, avoid contacting vegetation, avoid sitting directly on the ground or on stone walls, and keep your long hair tied back, especially when gardening. If you follow these simple steps, you should much lower your risk of being bitten by an infected tick this season. So stay safe and check for ticks this summer. This is Sophie Briggs signing off.
Hello, I'm Max.
And I'm Emily. Today we are going to talk about a disease that is very crucial to know about.
That's right, we'll be talking about rabies. Rabies is a virus that infects the central nervous system that can lead to brain damage or even death.
The virus is spread through a bite or deep scratch from an infected animal. While many animals can carry and transmit the disease, bats are the #1 transmitter of rabies in the United States.
The early symptoms can be hard to pick up on from other common illnesses. Some early symptoms are fevers, headaches, and bodily discomfort.
As the virus runs its course, more identifiable signs include partial paralysis, a salivation increase, hallucinations, and even hydrophobia. These signs are also present in infected animals other than humans.
It is important to be vaccinated for rabies because once the clinical symptoms set in, there's little to no chance of survival. We recommend vaccinating your pets or farm animals, reporting stray animals, and keeping bats out of your house.
Exactly. Make sure to take precautions when traveling to underdeveloped countries and making sure wounds, especially in the head and neck region, are clean. If you think you could have the virus, make sure to see a doctor ASAP to get your rabies shots.
Thank you, and we hope you have realized that rabies is an important issue and have learned how to keep yourself safe from the rabies virus.
And remember at home, if you see an animal foam, leave it alone. Thank you.
As we near the end of this school year, many of us will be thinking about the next few years of our lives and eventually graduation. It is expected that we will graduate in 2 years with no problems, but sometimes things can get in the way. Teen pregnancy is a major problem that can disrupt many aspects of a teen's life, but the biggest difficulty is with graduating on time. About 50% of teen mothers get their diplomas by the age of 22, while 90% of women who do not give birth during adolescence graduate high school on time. Even the children born to teen mothers are more likely to have lower academic achievement. Luckily, the birth rate for teen mothers in the U.S. has decreased 19.2% from the years 2007 to 2015. The best way to stop teen pregnancy is to abstain, but for those teens who choose not to, there are many types of contraceptives to consider. There are organizations spreading the information on copper IUDs, hormonal IUDs, implants, shots, rings, patches, pills, and condoms. While condoms should be used every time you have intercourse, the other methods have to be used before and have an effective range from 1 day to 10 years. Decide what to use while you still have the choice. Thank you.
You may commonly know the word fast as a way to describe how you run, how time flies by, or something you do for religious reasons.
But did you know that FAST is also an acronym used to save thousands of lives?
Strokes are the fifth leading cause of death in the U.S. and are the leading cause of adult disability. A stroke happens every 40 seconds, and someone dies from one every 4 minutes.
In FAST, F stands for face. Face drooping or the face looking uneven may be the first sign of someone having a stroke.
A stands for arm weakness. If you ask the person to raise both arms and one drifts downwards, that might be another common sign.
S stands for speech or slurred speech. Ask the person to repeat simple phrases. If the speech is slurred or strange, get help.
That leads us to T. T stands for time, which is critical when a stroke occurs. Getting help fast could reduce disability and death from a stroke.
A stroke may be caused by a blocked artery or the leaking or bursting of a blood vessel.
If someone begins to have a stroke and they lose consciousness, start performing CPR immediately, have someone get the AED, and call 911.
The quicker you get help, the better. It could reduce the possibility of temporary or permanent disabilities to the person suffering from a stroke.
Some possible effects could be paralysis, difficulty talking or swallowing, memory loss, emotional problems, pain, sensitivity, and a change in behavior or self-care ability.
Strokes can also be fatal.
There are many things you can do to help prevent strokes, such as watching your weight, staying active, eating healthy, avoiding large consumptions of alcohol and drugs, and using preventative medications.
And remember fast, as it could save a life.
Skin cancer is the most common type of cancer in the U.S. The three most common types of cancer are basal cell, squamous cell carcinomas, and melanoma. Basal cell and squamous cell carcinomas are highly curable but very costly to treat. Skin cancer is the abnormal growth of skin cells, a lighter natural color, family history of skin cancer, exposure to the sun, a history of sunburns, especially early in life, skin that burns, freckles, reddens easily, or becomes painful in the sun, a history of indoor tanning, etc. are all risk of cancer. A change in the skin is the most common symptom. Could be a new growth, a sore that doesn't heal, a change in mole, staying in the shade, especially during midday hours, wearing clothes that covers your arms and legs, wearing sunglasses and or hat, avoiding indoor tanning, and most importantly, using sunscreen with an SPF of 15 or higher. In both UVA and UVB protection can reduce your risk of getting skin cancer.
Hi, my name is Jeff.
Hi, I'm Kyla.
Our topic is weed.
Weed, you might ask?
Weed and or marijuana is referred to as a dried leaf, flower, stem, and or seed from the cannabis plant that alters the mind with the chemical THC, which more than 11 million people used or tried in 2015, mostly aging from 18 to 25 years old.
The main chemical THC is released from the plant when smoking and causes you to trip or hallucinate for 30 minutes to an hour depending on the dosage you take.
The way that it is used to extract THC can vary from hand-rolled cigarettes or joints, from pipes that contain water or bongs, and or in the new technology called dab pens.
Marijuana can cause both mental and physical problems leading to long-term and short-term effects in the body and mostly leave permanent damage.
The mental problems could consist of temporary hallucination, paranoia, which can also cause depression, anxiety, and suicidal thoughts among teens.
Along with the mental issues comes the physical problems, such as breathing problems, which usually are the same problems that people who smoke tobacco have. Along with that, an increase in heart rate for a few hours after smoking the cannabis, which also increases your chance of a heart attack during that time.
Along with those physical problems, for women who smoke weed during their pregnancy, their children are at risk of growing up with the brain or learning disabilities for being exposed to the chemical THC with an underdeveloped brain.
Lastly, in males, the use of cannabis leads to an increase in chance of getting testicular cancer at an early age.
Now just remember,
A friend
indeed will not make you smoke that weed.
Hello, my name is Jackson. And my name is Nathan. We're here to talk about the effects of vaping. Vaping has been booming over the recent years and is targeting younger audiences such as teenagers and young adults. And the reason that younger audiences are so interested in these products is because they believe it is a healthy alternative to traditional smoking. What proof do we have that these devices are negative towards your health? Vaping has been around for a little over a decade, and due to the fact that it is still so new, there has been no observed long-term effects.
The ingredients in the juice that fuels these devices is made of harmful chemicals such as propylene glycol, vegetable glycerin, and nicotine.
The nicotine in these is especially harmful, for it is what causes the addictive aspect of the juice and also gives the user a buzz.
A known cause of the juice is with the specific chemical called diacetyl. This can cause popcorn lung, an irreversible disease that damages and scars the lungs.
Most teens that use vapes are under the legal age of 18, showing that somehow they have access to these devices and that the regulations for these are not strict enough.
A recent poll shows the following on the use of vapes between 8th and 10th and 12th graders. 12th graders have 9.5%, 8th graders have 14%, 14% of 10th graders, and 16.2% of 12th graders.
Vaping is also a cause to start smoking. 30.2% of e-cig users started to smoke within 6 months, while 8.1% of non-users started smoking.
Although within the past year, one out of 3 12th graders admitted to using a vape.
Clearly the numbers are rising, and all we can do to stop it is to spread awareness of these harmful devices.
Another large risk that is posed to these young audiences is that our brains are still developing and the nicotine can affect it, causing addictions to be even easier in the future.
To learn more about this, visit don'tgetvapedin.com.
Hi, I'm Xavier Parker. I'm here to talk to you about addiction. Addiction is when you crave something and you can't live without it, like nicotine. You can get addicted to that really easily. It has a lot of chemicals in it. And along with crack cocaine and heroin, all these things are extremely bad for you. Addiction can be things that are good for you as well, like phones and food. It's just something that you have to connect with. And along with connection, addiction is very easy to get when you don't feel connected with, say, another person. People need to feel connected with other people, and the more you separate with other people, the more addicted that you can, and more addiction is easier for you to get. My plan is to make sure to tell you guys to help everyone out and be friends with everyone and connect with them. A healthy connection, not a bad one. Healthy connection is, say, a person who makes sure that you don't get in trouble and helps you out with like school. And a bad connection is a person who makes you want to have like heroin and try other drugs. Addiction is a problem with everyone in the United States because everyone is addicted to something. What are you addicted to?
I'm Kylie.
And I'm Emma, and we're here to talk about depression. Depression in teens is increasing at an alarming rate, with a recent survey showing that 1 in 5 teens suffer from depression. Severe depression in youth has increased from 5.9% in 2012 to 8.2% in 2015. Depression is a serious mental illness that interferes with a person's ability to complete daily tasks such as sleeping, eating, or doing schoolwork.
There are many ways to recognize and help treat depression. First, look out for the warning signs. Suicide threats, direct and indirect, obsession with death, poems, essays, and drawings that refer to death, giving away belongings, dramatic change in personality or appearance, irrational and bizarre behavior, overwhelming sense of guilt, shame or rejection, changed eating or sleeping patterns, severe drop in school performance.
Each year, almost 5,000 teens kill themselves because of depression, making it the 3rd leading cause of death in adolescence, so recognizing these warning signs early on are very important. There are a few ways to help and treat depression, including psychotherapy, cognitive behavioral therapy, interpersonal therapy, and medication.
There are also many ways to manage depression, such as staying active, getting a regular amount of sleep, spending time with loved ones, family and friends, and organized priorities.
Thank you.
A heart attack is when an artery to a heart gets blocked with too much plaque buildup. If you attack your heart, your attack might attack back. Risk of getting a heart attack are age, weight, high cholesterol, diabetes, diet, and other factors. Some warning signs of someone who might be having a heart attack include chest pain, discomfort of the upper body, breathlessness, cold sweat, nausea, and lightheadedness. After you have a heart attack, you might have to be hospitalized for 3 to 5 days for 24 to 36 hours. For the first 24 to 46 hours, you might be unstable.